Hello everyone, welcome back to my channel. Today I will discuss about hot and cold application. So at first we will discuss about hot application. Hot application is the application of a hot agent warmer than skin either in a moist or dry from on the surface of the body. Next comes to the purpose of hot application. To relieve pain and congestion, to provide warmth, to promote suppression. Suppression means discharge of pus, to promote healing, to decrease muscle tone, and to soften the exudates. These are the purpose of hot application. Next comes to the classification of hot application. It is mainly two types. First is local heat application and second is general heat application. In local heat application, it is mainly two types, dry heat and moist heat. In dry heat, we can see hot water bottles, chemical heating bottles, infrared rays, ultraviolet rays, short wave diathermy, heating lamps, electric cradles, electric heating pads. In moist heat, warm soak or local bath, hot fermentations, cold ticks or cataplasm, stoops or medical fermentations, paraffin bath, seize bath, aquathermia pad. In general heat application, it is mainly two type, dry heat and moist heat. In dry heat, sun bath, electric cradles and blanket bed. In moist heat, steam baths, hot packs, whirlpool bath or full immersion bath. These are the classification of hot application. Next comes to the contraindications of hot application. Malignancies, impaired kidney, heart and lung functions, acutely inflamed areas, on client with paralysis, open wounds, edema associated with venous or lymphatic disease, headache, client with metabolic disorders, very young and very old client, client with very high temperature. So these are the contraindications of hot application. Next comes to the complications of hot application. First is pain, second is burns, third is maceration with moist heat, fourth is redness of the skin, next is edema, pallor, secondary effect, and last is hyperthermia. These are the complications of hot application. Next comes to the cold application. What is cold application? Cold application is the application of a cold agent cooler than skin either in a moist or dry from on the surface of the skin. Next comes to the purpose of cold application. To reduce pain and body temperature, to anesthetize an area, to control hemorrhage. Hemorrhage means bleeding, to control the growth of bacteria, to prevent gangrene, to prevent edema, and to reduce inflammation. Next comes to the classification of cold application. It is mainly two type, local cold application and general cold application. So in local cold application, it is mainly two type, dry cold and moist cold. In dry cold, ice bag, ice collar, ice pack, ice cradle and chemical cold packs. In moist cold applications, ice to soak, cold compress, evaporating lotion. In general cold application, it is mainly two type, dry cold and moist cold. Dry cold, hypothermia. In moist cold, cold sponging, cold bath and cold packs. These are the classification of cold application. Next comes to the scientific principles involved in hot and cold application. Water is a good conductor of heat. Air is a poor conductor of heat. The flow of heat is from the hotter air to less hot area. Prolonged exposure to moisture increases the skin's susceptibility to maceration and skin breakdown, reducing the protection of the intact skin. These are the principles of hot and cold application. Next comes to the physiological effects of hot and cold application. In hot application, peripheral vasodilatation, increased capillary permeability, increased oxygen consumption, increased local metabolism, decreased blood viscosity, decreased muscle tone, increased blood flow, increased lymph flow. In cold application, peripheral vasoconstriction, decreased capillary permeability, decreased oxygen consumption, decreased local metabolism, increased blood viscosity, increased muscle tone, decreased blood flow, decreased lymph flow. Next comes to the general instructions. Assess the condition of the client prior to, during, and after the application of the heat and cold application. Before giving hot and cold application, we should assess the condition of the patient. Next is to check the vital signs. Maintain correct temperature for the entire duration of the application. Never use any equipment unless understand its operation completely. There must be a recovery period between the application. So this is the end of hot and cold application.